one of the most interesting aspects of this meeting, and I was looking at the clock because I was trying to figure out, this is the first time I've been around for 70 minutes and nobody had asked anything about healthcare. So, bravo, three cheers for you. And let me kind of walk it through. I don't know whether you're a single payer person or what it is you want to see done. But I have always felt that healthcare is the most important issue. I was director of the Gray Panthers of senior citizens for almost 7 years, back when I had a full head of hair and rugged good looks. And I decided then that if you and your loved ones didn't have your health, then pretty much everything else goes by the board. You can't even come to a town meeting, or go to lunch, or go to the Dairy Queen, whatever it is you're thinking about doing. So for me, healthcare has always been the most important issue. The most important issue. And I'm the ranking Democrat on the committee that really pays for American healthcare, or much of it. We pay for Medicare, we pay for Medicaid. We are the point agency for the various tax aspects of the Affordable Care Act, the president's bill. And without kind of launching into a huge lecture, because I want to give you a chance to kind of respond a little bit. When the whole topic was being debated before the 2008 presidential election, I would come to meetings like this. And I would tell people I'm on the finance committee. By the way, then I was quite a junior member. I didn't have the authority I have now. And I would say, I'm interested in your thoughts about what kind of health care you want. And people would stand up and somebody would say they're for single payer kind of system, a Canadian kind of system. A bunch of people would clap. Then after that, people would get up and say, no, I don't want that government stuff, because I have a cousin in Canada or somewhere and they had to wait for a hip operation, don't do it. And a bunch of people would clap. And I was sort of left with a head scratcher. And so what I did is I said, okay, both sides seem to have a fair number of clappers, people were for it. What would you think about saying that everybody who wasn't on Medicare or in the military would have the kind of care Congress people got? Oh my goodness, everybody was on their feet. You get them, Ron, you get them. And as I told Nancy Bass Wyden, I said, I don't think people know exactly what we have, but they figure if we have it, it's good. And so I went out and wrote a bill to do that. And we got 8 Democratic senators and 8 Republican senators. First time in history. First time. It's called the Healthy Americans Act. You can look it up. 8 Democratic senators, 8 Republicans. Everybody who wasn't on Medicare or the military would have choices like their congressperson. You basically go to what is now called an exchange, and there are various big plans, and they can't discriminate and all that kind of thing. Now, we obviously didn't get that. We got some of what we wanted in the Affordable Care Act. And I will tell you, on my watch, we are never going back to the days when the insurance companies can beat the stuffing out of people with a pre-existing condition.